For the first time, you are going to be meeting patients who are really sick, but who do not look that way, telling us again the wonders of this our 3 pound universe we call our brains. Hello and welcome to Psychiatry Posting. My name is Dr. Alvin, Dr. Peter. I'm your invisible guide through medical school. Your psychiatry posting is going to span through 6 weeks, in which time you're going to be learning undergraduate psychiatry. Off the bat, I want you to be very aware of one fact as you're starting psychiatry. Do not lose your guard. Be at alert at all times. The psychiatry world will not look like any celestial place, but you need to protect yourself at all times. Now, I want to tell you about the exam before I tell you about more of the posting. Your exam is going to be a full exam. By that I mean it's going to feature an essay part of the exam where you're going to actually answer questions in a written format. There's also going to be, of course, multiple choice questions in the exams, which will also have negative marks attached to them. And also, I want you to be aware that there's a traditional part of the exam where you're actually going to interact with the patient. You're going to present the patient, and then you're going to discuss management plans and other questions that might arise from your history. I want you to also be aware of something. The way you are going to interact with your patient, given maybe sometimes the limited amount of time we have, you are likely going to interact with your patients in a group. So maybe 5 students to 1 patient, and then you guys will interact with the patient, elicit the history, and then write them. I want you to be aware that no matter how long they give you for the exams in terms of the traditional part, the time is usually not going to be enough, because it is the history taking in psychiatry is actually very elaborate, and that is going to tell me, lead me to the next thing I'm going to tell you about, which is history taking in psychiatry. Unlike 2-page, maximum 3-page history you get in obstetrics, medicine, and surgery, in psychiatry the history taking is elaborate. It might take you up to 4-5 pages, from the history to the past medical history, the childhood history, sexual history, and all that. By the time you compile all that together, you're going to have a huge amount of information to be able to integrate, digest, and present. So I want you to be very aware of that. Now, for sources of information, sources of stuff or knowledge in psychiatry, you are going to be introduced to the ICD-10 criteria and the DSM-5 criteria, the Diagnosis and Statistical Manual for Diseases, DSM-5, and these are the standards with which you are required to make your diagnosis. Don't worry, you're going to be introduced to these in class, and it will be part of all the lecture notes you're going to be given. The lecture load in psychiatry is not that heavy. However, do not lose your guard in the posting. I think that is the underlying message. If you are a fan of video lectures, then I have a recommendation for you. Osmosis video lectures follow the Diagnosis and Statistical Manual for diseases. This is not what is obtainable in Nigeria, except it's just used in the US and some other countries. However, there are very close similarities to the DSM-5 and the ICD-10 criteria. If you're a fan of video lessons and you have the bravery to you have the guts to use video lectures and you really subscribe to them, then I will prescribe Osmosis videos for you. I'm sure you would have been familiar with Osmosis videos now. They discuss a wide range of topics in animated forms. It's fast and it's fun, and quite frankly, it's very, very easy to remember. So Osmosis. Now, more about history taking and physical examination. I want you to do what I call the perfect case. The perfect case is a concept that I use to remember. It helps us in presenting our cases to either when we're looking for signatures for a logbook or when we're in exams. The perfect case is when you meet someone that is actually skilled in that particular department. For example, a registrar or a senior registrar, and ask them to record for you the perfect case. The perfect case is what you would elicit in a normal patient. So in terms of history, and in psychiatry, particularly that area of differential diagnosis and past medical history, so that you get used to the psychiatric terms for describing symptoms, which is very, very different. Which is not so different, but is significantly different from the rest you might know from medicine and surgery and obstetrics and gynecology or pediatrics. I want you to use the perfect case. If you record the perfect case and play them over and over again, both in terms of history and physical examinations, you are going to get used to the lingo in psychiatry, and you'll be able to quickly and smoothly present your case during the traditional part of the exams. There are some big topics that are usual in the exams in psychiatry, and I want you to, pay extra attention to them. Topics such as, drug abuse, substance abuse, and disorder, you should, pay a significant amount of time to that part of your lectures. Reason why is because of how common it is in the world globally. It is important in real life as well as your exams. You should also pay attention to suicide and parasuicide. Given the epidemics of suicide we have in the world and even in our country today, it becomes a common case scenario which will likely reflect in your exam in one way or the other. Forensic psychiatry, actus real, mens real, you should take a look at that also, because it's important when legal cases come up. You are going to have a short exposure to psychiatry, and for many of us, for most of us, psychiatry is not our first love. So you should pay attention now, because this is going to be most of the psychiatry you're going to be getting in your career. So whatever you learn now, you're going to carry it alongside with you, for a long period of time. Let me also say that this is another time where you will have to go back and relearn CNS pharmacology. So you are going to have to go and learn antidepressant, antipsychotics, and all those alcohol and all those pharmacology again. If you do that, if you go back and relearn your pharmacology, you would appreciate, therapeutics in psychiatry, and you would actually do very well in your exams. And if you are going back to review CNS pharmacology, I can as well just recommend that instead of going back to your textbook, you can subscribe to Professor Leonel Raymond, the expert, pharmacologist, pharmacist, biochemist, who has very beautiful analysis of CNS pharmacology, and he pulls the connection to psychiatry in all the topics. If you go there, it's short, it's fast enough, and the funny nature of Dr. Raymond, he's going to put you through quickly so that you can come back and then have a good grasp of psychiatric pharmacology, as well as another topic you should pay attention to will be stress management too. So let me take it again: suicide, parasuicide, drug and substance use disorder. Of course, you're going to be learning the traditional course topics in psychiatry, but these are very important to learn. So parasuicide, suicide, drug abuse, and stress. Of course, pharmacology will be also important in this case. So, in summary, it's a 6-week posting. It's going to reflect both a traditional and a theoretical part of the exam. Osmosis is a good reference to go to, even though it uses diagnosis and statistical manual 5 in making the diagnosis and formulation of even the management. It's important that you do the perfect case so that you get used to the psychiatric lingo when you present and take your exams. So thank you very much, guys. A video analysis of all your other postings from medicine to surgery. I wish you a beautiful posting. Cheers.